think we have made tremendous progress in stroke care over the last few decades.
Since we have shown that thrombectomy is very effective, we found out that we can treat many more patients than we initially thought.
If you think in a world perspective, there are many countries that have no access to care for this technology at all.
Education, I think, is a very important area which we can improve on, particularly in developing countries, but also just the access to that care from an economical standpoint.
We need more focus on endovascular treatment. We need the policymakers, governments, industry, insurance companies.
We actually have to also focus our attention to the gaps in stroke care that you have worldwide. I learned with a colleague that when you treat a patient, you change one life at a time. When you educate people, when you train people, you can then change hundreds of lives, right? Because that potentiates what you do. But it's only when you do high quality research that you touch thousands, if not millions of lives, right?
The work that WSO is doing, advocating, reaching out to governments and educating on, the impact of stroke is a big part of that. Reimbursements, I think groups like Philips that are making this education more transparent is only going to help grow this around the globe. It's really one of the most rewarding treatments that we do in neurointervention. As a radiographer, from setting up the room and the patient entering and seeing the state that they're in and being able to see them walk off of the table at the end of the procedure sometimes is really impressive and I think amazing.
And now that I actually can change their lives, it's very rewarding.
So I think we feel very privileged of having been part of some of these studies that have elevated stroke care around the world. But we keep fighting, and that's what matters.